hope you are having a good day. The topic of discussion is psychogenic polydipsia. What is this? Well, polydipsia means thirst or excessive thirst, and psychogenic means it's from a psychiatric cause or a neurologic cause. So together we see psychogenic polydipsia in a psychiatric hospital as a possible symptom of schizophrenia. So it's important for us to know how can we manage this, or what are some of the pharmacological treatments that can help symptoms subside, to help the effects of pathological water drinking be minimal. So in this case, there are situations where water can be deadly, and somebody with this psychogenic polydipsia can be so thirsty that they'll be on water restrictions and they'll be on the units, and we'll have to monitor how much water they're drinking. They could even be drinking water from the toilet. No fluid is off limits because of how thirsty they are. So polydipsia and water intoxication are associated with long hospitalization, high doses of antipsychotic medications, moderate doses of anticholinergic medications. These can dry you out, and heavy smoking. The first step of treatment is to eliminate other known causes of polydipsia, and also to see if it can be due to drugs like corticosteroids can make somebody more thirsty. Also, anticholinergic medications or medications with anticholinergic properties can make someone more thirsty. So, to a patient we looked at, they were on anticholinergics, but the benefit of medications that are anticholinergic can still outweigh the risk with these medications. But other reports state dry mouth is not a likely contributing factor and not the sole cause of psychogenic polydipsia. Sertraline is another medication, as well as a couple other antidepressants, that have a couple case reports of a patient exhibiting psychogenic polydipsia behavior and it discontinuing when the antidepressant is discontinued. So there have been different medications that have been suggested to improve polydipsic behavior and prevent hyponatremia. The following list of medications has some level of evidence in the management of psychogenic polydipsia. The first is enalapril, which is an ACE inhibitor, or an angioconverting enzyme inhibitor. It's usually used for blood pressure, but it has been shown to be effective as prophylaxis for self-induced water intoxication in a case report. There was a double-blind crossover study of 14 patients who had the symptom of psychogenic polydipsia, and they took placebo, clonidine 0.2 milligrams BID, or enalapril 10 milligrams by mouth 2 times a day during 3 treatment phases in a 6-month period. 60% of the study group improved in calculated urine output, so they were holding on to less fluid, and urine osmolality, so it wasn't as diluted and they weren't holding on to the fluid. But it showed inconsistent changes in serum sodium, and this is where we get in trouble. If somebody is retaining so much fluid, their sodium levels will go so low that it can cause a seizure and can be lethal. And the enalapril also showed inconsistent changes in diurnal weight gain. So we look at diurnal to see how much fluid they're drinking in the day, and it showed inconsistent changes. There's also an antipsychotic olanzapine. There was a case report that a schizophrenic male with severe polydipsic behavior found the symptoms subsided and the patient had stabilization of weight occurred when a patient was changed from risperidone, another antipsychotic, to olanzapine. And the addition of a angiotensin II receptor blocker, irbesartan, to this regimen further reduced polydipsia. And despite this promising case report, olanzapine showed lack of effect in a prospective trial in 10 schizophrenia patients over 8 weeks, which is unfortunate. Another antipsychotic that has shown an even greater amount of evidence in treating psychogenic polydipsia is clozapine, which we see in treatment-resistant schizophrenia patients. And it has shown to be effective in normalizing polydipsic physiologic measurements, including normalization of hyponatremia, less fluid restrictions, and a marked reduction in fluid-seeking behavior. Another study, it was a 24-week prospective study in hyponatremic patients with treatment-resistant schizophrenia, found fewer fluid restrictions and found plasma osmolality normalized in water intoxicating patients at a dose of 300 milligrams a day. The study consisted of 10 male patients, and all conventional neuroleptics were discontinued and started on clozapine. Only benztropine was continued, and this wouldn't be a contributing factor, I don't believe, because benztropine is an anticholinergic, which can cause dry mouth. There was one patient that suffered a seizure after starting clozapine, which is kind of an idiosyncratic adverse drug reaction with too high doses of clozapine. Another study found similar results between the dose ranges of 450 to 800 milligrams a day of clozapine in 5 male patients, and this resulted in a decline in the brief psychiatric rating scale score and a marked reduction in fluid-seeking behavior. Propranolol, another medication on this list, is a beta blocker, but it is a beta blocker that crosses the blood-brain barrier. So they believe that it also has efficacy in treating anxiety, as well as can be used in adjunct therapy and other psychiatric conditions. A case series of 3 polydipsic patients started on propranolol doses of 30 milligrams to 120 milligrams resulted in decreased fluid intake. 2 case reports showing benefit of propranolol in doses of 160 milligrams or 320 milligrams in psychogenic polydipsia treatment. So there's not a lot of evidence for any of these medications, but it's hard to have cases, a lot of cases, and to study the treatment of these cases and then to publish reports of these cases because they're few and far between. Irbesartan, which we already talked about, and it being used in adjunct with olanzapine to treat a 39-year-old schizophrenic male, there was another case report of a schizophrenic patient with polydipsia who was treated with irbesartan and also naltrexone, which this combination had a successful outcome. Naltrexone is an opioid antagonist, which we see sometimes used in impulsive disorders, but we mainly see it used in addiction treatment. Acetazolamide, which is a carbonic anhydrase inhibitor, we see this used sometimes for blood pressure, but very rarely. We usually see it in eye drops as well to decrease fluid in the eyes, but we sometimes use it in a psychiatric hospital in a case series involving 5 mental hospital inpatients who demonstrated excessive fluid intake, restriction of fluid intake, and required restriction of movement because of this pathological drinking of water. Showed that acetazolamide improved polydipsia and hyponatremia in 4 out of 5 cases. And acetazolamide, by its mechanism, can help increase serum sodium levels in a patient with hyponatremia. A case report involving a 56-year-old male was started on 250 milligrams a day of acetazolamide, and this resulted in an improvement in hyponatremia and polydipsia as well as water intoxication. So, another therapy that can be used for these symptoms of psychogenic polydipsia are opioid antagonists. We talked about naltrexone and it being used in combination with irbesartan, but there was also in the literature a case of 3 patients with schizophrenia with psychogenic polydipsia syndrome, and this showed that an administered injection of 0.2 milligrams naloxone hydrochloride at 3 times a day, once every 14 days, resulted in a decrease on maximum weight gain a day. So this tells us that the patient is not drinking as much, increasing the body weight. And this is somewhat surprising because naloxone has such a short half-life and it doesn't last throughout the day. We mainly see naloxone used as Narcan to treat opioid-induced respiratory depression or overdose. So this is somewhat surprising, but it makes kind of sense since a similar drug, naltrexone, has shown some benefit in treating these impulse disorders. So there are also other reports in the literature. If somebody's hyponatremic and is drinking a lot, potentially high-dose sodium chloride can be used to restore sodium levels, but this is not recommended due to a high incidence of hypertension or high blood pressure. Phenytoin, which is an anticonvulsant, is speculated to help because it has a transient ability to suppress antidiuretic hormone release and may be helpful in those who have hyponatremia and a risk of seizures. Phenytoin's low therapeutic index and risk of drug interactions make it less than ideal. Lithium, which is a mood stabilizer, has been used to treat refractory psychogenic polydipsia due to it being a direct competitive antagonist of antidiuretic hormone action, but can increase thirst, induce diabetes insipidus, and it can have nephrotoxic and thyroid toxic effects, and its narrow therapeutic index makes it undesirable for treatment of psychogenic polydipsia. And then there's I'm having so much trouble saying this, I apologize. Demiclocycline, and this is used actually off-label for syndrome of inappropriate antidiuretic hormone. It's an antibiotic, and it's also used for nocturnal enuresis. It has been reported to show benefits in both hyponatremia and polydipsia, even in the absence of classical syndrome of inappropriate antidiuretic hormone. However, this demiclocycline is associated with nephrotoxicity and has not been found to be efficacious in double-blind placebo-controlled trials. So, in summary, there is few reports in the literature on how to treat psychogenic polydipsia and schizophrenia patients. So we have to use what we can to make the best informed therapeutic recommendation as possible and provide the patient the most efficacious and safest medication as we can. And these are the variety of drugs I found in the literature that are reported to help manage psychogenic polydipsia. I hope you enjoyed this literature review, and if you have any questions, let me know, or if you have any more information to provide in addition to this, I'd appreciate if you let me know as well. This is a team effort, so thank you so much, and I hope you have a nice day.